36 is an outlier.
A question I was asked in a job interview was, what's the thing that you dislike most about nursing? And my answer in my job interview was the stereotype of nursing.
If I say I'm a nurse, you get a variety of reactions. Oh, that's wonderful, and that must be a very difficult job.
I think some of the preconceptions about nursing is that, you know, the old-fashioned nurses are handmaidens.
She'll be working in a hospital ward, she'll have a paper hat on her head and a uniform on, and she'll be pandering to the doctor's wishes. All the preconceptions about nursing need to be put to one side.
There's a lot of men in nursing these days, in some fields more than others, and indeed in the critical care field that I work in, there are as many men, or maybe even more men, than women in our ITU.
I work with 13 to 19-year-olds. I see a lot of young teenage lads are picking health and social care as an option. It's not just a female profession anymore. There are more men coming into it.
The service is much more now being delivered closer to patients' home, and that's very much on the government's agenda. So rather than there being more people working within a hospital ward, actually there's going to be a lot less. It's not just the environments that are more diverse, it's actually the skills that people are required to have are much more diverse. Nurses that, you know, increasingly have taken on prescribing responsibilities.
I think the image, even just like the visible image of the nurse, has changed, but also the roles that we take on. We do support the doctors a lot more now. It's a lot more nurse-led as opposed to necessarily consultant-led.
As the nurse, we know the patients better because we're here for much longer. As a ward sister, I tell the doctors on the ward which patient's probably ready to go home. From my experience, my knowledge, I'm able to give an equal input in terms of the patient's plan of care. The nurse is at the heart of the patient care.
I started on 18,000 a year. I've now, through the course of the last 5 years, progressed to over 40,000 a year. So I think it shows that you can progress if you put the hard work in, if you do the courses, if you're motivated to make a difference. But I think the pay scale and the pay rewards are there.
The money thing is in every job. If you're just going to stay there and say, okay, I'm just going to do that, there's agenda for change. Depending on how well you're doing, how well you're pushing yourself, you're motivating yourself, it's up to an individual.
The thing I like about nursing is that there are so many different roles that you can fulfil, and that gives you so much variety. So we have nurses that are working in ward areas, we have nurses that are working in critical care units, we have nurses that are working quite independently as clinical nurse specialists or nurse consultants.
Because even if you go into one of the main specialty fields, within those specialty fields there are so many different subgroups.
Until you find out a little bit more about nursing and the different options there are and what different fields of nursing there are, you realise there's a whole world out there that you're missing really in terms of nursing.
We are nurses, qualified nurses. We don't wear uniforms, work Monday to Friday 9 to 5. Nursing is not just about working in the hospital, it's about working in the community. There's just so much in nursing. It's just up to the individual to choose which way you want to go.